Well, Tarik Jasarevic is the spokesperson for the World Health Organization and joins us from Geneva. Tarik Jasarevic, thanks very much for joining us on TRT World. Now, there are reports coming out in the last few hours that the cholera outbreak may have abated slightly. What more can you tell us about that?
Well, as you said, this is one of the worst humanitarian crises in the world right now, with 75% of Yemenis people needing humanitarian assistance. It's the largest food crisis, and it's also the largest cholera outbreak right now. As you have said, we receive some reports that the number of new cholera cases is declining in some areas, but we have to be very cautious because we need to analyze this data better. And even if this is the case, we still know that thousands of people are falling sick every day, and that cholera outbreak is far from over. The rainy season is just starting, and there will be many more people who will fall sick and that will need our assistance.
And Tarik, we were reporting a few weeks ago that the WHO had stopped trying to get aid in because of the security situation in Yemen. What's happening with that currently? Are you still making efforts to get aid in to help those who need it so desperately?
Well, World Health Organization is working with the health authorities across Yemen and obviously with other partners to bring as many assistance as possible. We managed to set up nearly 3,000 cholera beds in diarrhea treatment centers. We managed to set more than 700 what we call oral rehydration solution corners. Cholera is relatively straightforward to treat. People who have mild symptoms just need to take oral rehydration solution. Those who have severe symptoms need to have antibiotics and to get IV fluids. So we are really working around the clock to save lives and stop this outbreak. And again, it is working. More than 99% of people who have got the disease recovered. So there were more than 400,000 cases of cholera since the second wave of this outbreak started end of April, with relatively small number of deaths. So this means that our response is working, but we need to scale up. We need to reach everyone in the country. This is a big country. Many areas are difficult to be accessed. So we are really appealing to our donors to disperse the money that it has been already pledged, so we can try to save as many lives as possible.
And Tarik Jasarevic, you talk about scaling up, going to your donors. I mean, who is it who's promised money for a situation like this and has not delivered?
Well, we are really grateful for all the contributions we have received from a number of countries. So far, 53% of what we have asked for this year have been pledged. So we are really waiting to see all these pledges being translated into actual funds, so we can set up more treatment centers. We can set up more rehydration corners for people who have cholera. But not only cholera, we should not forget that the health system in Yemen is close to collapse. Health workers have not been paid for nearly a year. There is a shortage of medicine, so people who have chronic disease unfortunately die from it. Hospitals have not any budget to maintain their operations. All of that is really something that is of a great concern, and if we don't scale up our operations, Yemeni people will continue dying.
And finally, Tarik Jasarevic, what are you doing in terms of making sure that the aid that does get in to Yemen is secure? Of course, the country's been in the grips of civil war for a number of years now. How are you making sure that the stuff does get in and gets to the places that it needs to go?
Well, together with the other UN agencies, we are exploring every mean of transporting aid into country. We've recently chartered a flight with 400 tons of medical supplies, including 20 ambulances, so people could be transported to referral medical facilities. We also use, when we can, airports that are not really operating, but are hosting only UN flights. So we are really trying to get any possible mean to get things inside. What we really need is operational capacity on the ground. We need to be able to have partners in every part of the country, so we can reach people who are sometimes in a very difficult situation because they are in a war zone, and for them it's really difficult to travel to the nearest medical facility.
Absolutely. Okay, Tarik Jasarevic from the WHO in Geneva, thank you for your time.